Good morning, everyone. I'm Dr. Varut Pungsapit as your moderator today. This is the second day of the online meeting on COVID-19, challenge and lesson learned from education. I would like to welcome members from China ASEAN Consortium of Health Science University. Today we will have two interesting topics about technologies in future medical education and student journey during COVID-19. Now, we are going to start with the first topic of this morning sessions, technologies involved in future medical education. So it is our great honor to have Professor Sun Kyodun, Director of Peking University Health Science Center, China, as the chairman of this topic. Everyone, please welcome Professor Sun Kyodun.
Can you hear me? Hello?
Okay, I can hear you now.
Thank you, Professor, for your kind introduction. Dear colleagues, can you hear me?
Yes.
Dear colleagues, good morning. It is my great pleasure and honor to chair this session today. Here, I would like to take this opportunity to thank the host, Faculty of Medicine Silra Hospital and the ASEAN Medical School Network for your kind invitation to me and the other colleagues from China to join you at this online conference. And I believe that there will be more chances for the colleagues from both ASEAN countries and China to exchange views and share experiences in the future, since we have just established our China ASEAN University Consortium on Medicine and Health. Well, as the MC introduced just now, the topic for this session today is technologies involved in future medical education, which is certainly a very, very important topic for discussion at this particular moment when COVID-19 pandemic is spreading in the globe. And I'm sure that we'll all benefit from the presentations here today. We have 4 speakers in the first session, in this session, and there's a Q&A part after all the presentations are presented. And also, okay, for the audience, you can raise questions anytime in the chat box. Okay, now let's come to the first speaker, Professor Liu. Professor Liu Hong is the director of the Office of Medical Education of Peking University Health Center. As the director, she has been taking the lead in the work of online education, teaching development, and domestic collaboration on medical education. Her presentation topic today is evolution of online medical education from the outbreak of COVID-19 to the era of new normal. Professor Liu, please.
Okay, thank you. Can you hear me?
Yes.
Yes, okay. Good morning, everyone. I'm very happy to share the experiences in our school about education and topics. So I'm Hong Liu from Beijing. Yes, my topic is the evaluation of online medical education before and during and post COVID-19 pandemic. First of all, some of the general information about the whole picture of our education system. Each year, there would be around 900 students take part in our undergraduate program, and hundred post-graduate students enter this medicine, stomatology, preventive medicine, pharmaceutical science, biomedical laboratories, joined this undergraduate program each year. Here, this slide shows the study phases and the locations because students always move from locality journey.
Well, I'm sorry. Can you hear Professor Liu clearly? 不行，听不见这。Hello?
The signal is not good.
I don't think the internet connection is good enough for us to. We'll try to solve it out.
Okay.
I'm so sorry. So, but you can hear me clearly, right?
Yes, I can hear you.
Yeah, you're very clear.
Very clear. So maybe I will continue. Now
Yes.
I have come to the second slides about study phases and locations. Is that clear?
No, it's okay.
Now it's okay. Okay, let me continue.
We no longer see your slides.
No longer. Okay.
Professor Liu, your slides. Please share your slides.
Show me slides here.
Share your slides.
Is that okay now? I have full screen now. Is that
Your
okay?
slides. We cannot see your slides.
Okay. Okay, where can I share the screen? Zoom. Sorry, please wait a moment. I will replay my slide. Can you see the slides now?
Yes.
Yes. Okay. May I start to restart? I'll just continue. Yes. For the first slide, I just give you a whole picture of the education system in our Peking University Health Science Center. And now I have moved to the study phases and the locations of the students. I said in the first year, all the students will study in the main campus of Peking University for their general education. And then in the year 2 and year 3, they will move to the campus of our Health Science Center to study their major related disciplines in the basic medicine, basic medical sciences, pharmaceutical sciences, public health related courses. And then in the last year, in the final year, they will move to the affiliated hospitals or teaching hospitals or other institutions to finish their clerkship or internship. So this is a quite sophisticated education system. So we should use technology or digital tools to get good cooperation between the teachers. But in the past, in the COVID-19 outbreak, the teachers always prefer, our teachers are relatively conservative. They prefer traditional ways to deliver the study content, to interact with students, and to evaluate the students' performance. And in this circle, we can see some of the main teaching ways we have, for example, lectures, the small group PBL or CBL discussion, and we always use OSCE for the clinical skill evaluation, and also some simulation-based medical education. And compared to the face-to-face traditional way, only a small proportion of the teaching relatively few teachers use online as their teaching ways. That at the school level, we have no mandatory requirements to ask the teacher to use whether or not to use online education. So that's always depending on the teacher's own interests. Most of the teachers only use online material, for example, of the images banks to study pathology, histology, and provide some question banks for the students to practice before the examination. And a few teachers produce MOOC to open to the students outside this university, to the students to other universities countrywide. But COVID-19 changes everything, not the living way, but the study way and the learning way. After the Wuhan lockdown in the end of January, the spring semester began in the middle of the February. We were so lucky. We have 3 weeks to prepare. So we make that big decision to close the campus in the spring semester, but to keep teaching and learning. So all the teachers reached a consensus very quickly. Everybody were aware the only way we can take to achieve this this goal in the next semester. So we take a learning management system quickly. This system we have discussed for so many years whether or not to use it, but in the winter semester, in the winter holiday, everybody agreed to use this platform. So we asked all the teachers to establish their courses on this platform to produce the learning materials, for example, the syllabus of each course and instructions of each course to let the students know the study goal and how to evaluate them. And all the teachers' narration, and they have to upload this material on the platform before the new semester. And all the teachers get support from a very helpful team. They teach the students how to use the platform, how to produce the PPT with the narration, how to record them, and how to upload them. And the students also get support from our university to let all the students know the new learning way in the spring semester and get them some financial support if they need it to get the cell phone or some Wi-Fi packages. And when the spring semester began, we let this new learning material to be accessible to everyone. So the whole teaching process has been finished online, that including the lectures, the PBL, small group discussions, the assessment, also the final examinations, and some thesis presentation also be finished online. And here for some final examinations, we always use 2 equipments. And one equipment is used as Zoom, like today, to broadcast the students' behavior. And another equipment is cell phone. The students will answer the questions to finish the examination on the cell phone, but at the same time, the cell phone can take pictures and to have the facial recognition. So that 2 equipment can guarantee the students will be viewed 360 degrees. And also the teachers use various ways in their classrooms. Not only the platform we provided to them, they also use Zoom's WebNext and other instruments to interact with students. And some teacher flipped the classrooms. They use the real-time classroom to discuss with the students. Before the classroom, the students have already reviewed the material or the PPT the teacher gave them. And here I summarize some of the benefits we get from last semester. First of all, the teacher's technology skill has been improved a lot, and the confidence has been built among the teachers. And most of the teachers was satisfied about this new way to teach. And some of them has very good experiences on them. Because, for example, in one course, the teacher invite his friend in United States to join the PBL discussion. And both the teachers and the students have very good, fresh experience. It's very exciting, and students think, oh, we have another professor from the university at the other side of ocean, and they got fresh perspectives. And students can learn, can study at their own rhythm. They can review the material before the class, then they can review after the class, and they can speed up the PPT, and they can repeatedly to find some most important parts to review again and again. And from the administrator's point of view, we can follow every mouse click, both of the teachers and the students, if they use the platform. So we also get some data, big data, the study, the track, the teaching track and the learning track on this platform. And also the teaching contents are much easily to standard and to shared between I said, we have 10 teaching hospitals, and we produced demonstration videos, for example, for the surgical procedures. And we produced them at high level, and we shared them between 10 teaching hospitals. And obviously, there are shortcomings for this totally online learning. First, some of the courses cannot be achieved, cannot be put online. For example, the practical anatomy that will train the students' hands-on skill, and some experiments, and also some clinical procedures. And these kind of courses have to be, we adjusted the sequences of the courses. This kind of course will postponed to this semester when the students return to the campus. And another shortcoming is the real life campus life, because students, when they are together in this campus, they can have some informal interaction with teachers and with their classmates, with their roommates. And if everything just online, their campus life will be dry. So luckily, we have this semester, there's no cases in China. So we have begun our new semester. Real campus life has begun 2 weeks ago. So what kind of new normal we are facing this semester? First of all, the uncertainty about COVID-19. We cannot guarantee they will not come back in the winter, in the autumn. So we have to be well prepared. We are ready to change, to have the transition to the online education at any time. And now the students, overseas students cannot return to campus, still cannot come to campus. So we have to give them online method. And first, and the second challenge we are facing now is the integrated curriculum reformation, because we want to break down the barriers between disciplines. to have more integrated content to provide new curriculum to our students. So we will need a lot of cooperation and discussion among the teachers from different hospitals or from different campus to prepare their lessons, to prepare their class. So the online tools can help them to cooperate more frequently. And the third thing we are facing as the native internet learner, most of our students are very young. They are quite comfortable to get information online. They can do everything online, get information, build relationships, to find some friends with same hobby, and to play game online. And also our teachers are more confident and they are quite skillful, use online technology or digital technology. So all this, so this come to this slide. What we want in the future is first the content can be accessible anywhere, inside campus or outside campus, inside China or outside China. We have to prepare for that. And second, the students want the study more flexible anytime at their own rhythm to preview or review all the content. And the education reformation require we have the content transdisciplinary, multidisciplinary, and the students want their content more individualized. They can choose what they want to learn and what they interested in. So, okay, sorry. From passively accept to actively use, we need a balanced combination of face-to-face education with online education in the future. The first step is to have face-to-face with live broadcasting and plus replay after the classroom. Now we have achieved that because we have begun our autumn semester for 2 weeks, and 90% teachers can achieve this. And the second step, we want to teach our training our teacher on the pedagogy and the technology, because some of the experts say technology is not the hard part of online education. How to use technology in the most suitable way is the most important part of this new combination form. And finally, we want the learners can learn better. That is the goal of us. So we want the teachers can flip the class to flip the classroom, to let the students talk more and do more instead of just sitting there and listening to the teacher passively. So thanks for everybody's attention. We are very happy to have this chance to share our consideration with you.
Well, thank you very much, Professor Liu, for a nice talk. And your talk reminds us that, the persistence of COVID-19 may fundamentally change the landscape of medical education. So faced with the looming new normal, teaching technology surely play a very important role in the future. And we also need to take other factors into consideration. Okay, now we come to the second presentation, in this session. Our next speaker is Professor Pasit Wattanapa. Professor Pasit is the Professor of Surgery and Dean of Faculty of Medicine, Cerebral Hospital, and the former President of ASEAN Medical School Network, as well as the current President of China ASEAN University Consortium on Medicine and Health from the ASEAN side. Now let's welcome Professor Pasi to address us on the future technology for future medical education. Professor Pasi, please.
Good morning, colleagues from the ASEAN countries and also from China. Good to see you again, our colleagues from China. What I'm going to do in this section is to give you an overview, a brief review of the future technology for future medical education. In fact, some of this technology, we already have it, but we would like to improve the quality of what we do have. But at the same time, some technology, we are now implementing it. Some of the technology, we have not think about it yet, and maybe in the future, we might not adopt it. There's some reason which in the next section, you will see some survey from our students. Sometimes when we implement some high technology, in fact, we are widening the gap between students. And we are leaving some students behind, particularly those who cannot catch up with the technology. So let me start with my, can you see my slide? I think I have shared my slide. Anyone can see it? Please, just let me know. Not yet, right? ยังไม่เห็น Oh, hope you can see it. Hope you can see it now, right? Okay. I think we can recall the concept paper by Julio Frank and Rincon Chen that the healthcare education of any particular country should produce healthcare professions that are competent enough to get involved in the healthcare services of the countries. I start with this because, in fact, the future healthcare system, there will be a lot of change. We will move more and more on health promotion, disease prevention, outpatient care, ambulatory care, home care, and also precision medicine and telemedicine. Because of the COVID, let's say 3 months ago, telemedicine have not been implemented yet in Thailand. But because of the COVID, we started the telemedicine almost 2 months ago and use a lot of technology, and some of the patients, they are used to with the telemedicine, and I do believe they will be our persistent or permanent customer on telemedicine. But some of them, finally, they change their mind, particularly when we do have a better situation of COVID-19. They move back to the hospital. Although we try to convince them that telemedicine provides the same quality, but some of them they don't like to have it. Anyhow, the future doctor, they need to know how to use the telemedicine. And because the curriculum right now is the outcome-based curriculum, so the healthcare education, we need to focus on the so-called future healthcare services. I also mentioned about humanizing medicine, just to emphasize that it is not the technology that per se improve the quality of life of the patient, but the care of what they feel, relieve their suffering, particularly their anxiety or their concern about their illness, the part of the humanizing medicine. I present this just to show you that regarding the curriculum or the objective, I do believe in the future, doctors cannot just only focus on medicine, but they have to focus more medicine and also more on some technology related to medicine, or even some kind of communication information technologies. Some of them, when I put a blanket after medicine, a blanket plus technology, I mean, we use some knowledge in technology as in the elective part of the medical education. But for medicine plus technology, we mean that we are now using the pie-shaped education. It means students need to know in depth, not only in medicine, but also in some kind of technology that I'm going to show you later on. Regarding the teaching and learning processes, we feel, and I do believe in the future, we still keep some traditional kind of teaching and learning process, but also add some high technology. I use the term high technology assisted learning process. For the evaluation, the on-site and the hybrid. During this COVID-19, we have done some online evaluation. There's a lot of problems. Some we can solve it now, but still, whenever possible, I think to do the on-site or the combination of on-site and online will be much better than to do just only the online evaluation. This is what we are now moving toward. We change our curriculum. Next year will be our new curriculum of medical education. We start the pie-shaped program. Looking at the global trends, future doctors, they should know about computer or digital science, artificial intelligence, data information science, the biomedical engineering, the health system science, the healthcare management, and also the behavioral science. We put out these seven contents. Students just choose one. Just only some of the students, not all of them. Students who are good enough, who are competent enough to use this pie-shaped model, they will decide to do the so-called double degree. I mean, during the 6-year education, medical education, some of them will take the master degree in either of these 7 aspects or 7 issues. We have the linkage with some of the faculty under Mahidol University, but at the same time, we have some programs that connect with our colleagues in the US. That means some of the students, when they finish the 6-year program, hopefully they get the MD and also master degree. The one who we are now establishing with the Oregon Health Science University in the US is the information science and also health system science. When we talk about the pie-shaped, not all the students will get into this pie-shaped medical education program. Some of them will take the elective period, spend a few weeks, 4 to 8 weeks, select some of the 7 issues. And then at least they know something, at least they have some ideas about of the 7 issues. I do believe by having all of this during their medical education, we are now preparing our future doctors to cope with the future healthcare problems. This is a diagram about the teaching and learning process. In the future, we must have something that facilitate or improve the effectiveness and the efficiency of the teaching and learning process. And I think the teaching and learning technology will help us to do that, the on-site, the online, and on-demand. I put it on-demand because right now, when we do the tele-education, some of the students, they enjoy having the online, the synchronous program, I mean, together with their friends. But some of them, they do not happy with that. And so we also do the asynchronous class. That means the student can get into the content whenever they want. In the lower part of this slide, the adaptive learning. In the past, we realized that some of the students, finally, they left the medical education program because they have some problems. In the past, we did not know exactly what the cause, and we would like to know that. Therefore, we are now established the Department of Information. We are now gathering experts in this area, information science, and part of their job is to do information about the medical education, about the medical students. And this is a part of the adaptive learning. I mentioned about, I will explain in detail later about the AI and the learning analytics to adopt the adaptive learning. Regarding the future technology, this is the common goals of the technology for future medical education, to create the realistic learning environments, to gain experience with devices that will become common in practice. In the near future, I do believe there's a lot of technology come into the healthcare system. The AV, the AR, the VR, the robot, and whatever. Also to provide the student-centered learning activities, the on-site, the online, the on-demand, and also to gain the continuum of medical education. I put the continuum education because if we look back, after the world get into this 21st century, we already have 4 episodes of pandemics, 2 every decade. You can expect that we're going to have another pandemic again in the next decade. So we don't want to have an interruption of medical education if we're going to have another pandemic again. We put the teleeducation down in the lower part of the slide. Some of our teachers or our faculty, they have done a good job and they enjoy using the Zoom, the WebEx platform. And some of them moved the next step. Some of our faculty, they are now doing an interactive class by using this technology. And the students enjoy when they start doing the interactive classes. But not all the students enjoy this kind of teleeducation. We have done a survey with our medical students. 1/3 of them, up to 1/3 of them, they did not enjoy the teleeducation. They would like to join the on-site education. Some of them are now quite depressing. I don't want to say depressing, under stress of not having the campus life, of not having a chance to join the social life with their friends. And some of them cannot adopt themselves, cannot modify themselves or adapt themselves with this kind of teleeducation. The AR, the VR, we are now establishing just the beginning how to use this AR and VR in our medical education. Regarding how to gain the clinical competency, we established our simulation and skill lab 4 or 5 years ago. And we are now improving the quality of the technology in order to make sure that our medical students and also our healthcare professions gain more and more clinical competency. And I do believe many medical schools right now already have this simulation and skill lab. This is another technology that we have not implemented yet. And we have not decided yet whether we're going to implement it or not. That is the use of the hologram and the HoloLens technology. If you see on the upper part of the slide, the student can learn anatomy by using this technology because it's a 3D platform where they can study in details while using this hologram. And at the same time, the list of the benefits of using this hologram technology, the illustration of process in 3D, the breakdown distance barrier with geographically connected remote classroom. You can merge the class from different countries or even from different continents. The lecturers can do the multiple classes at the same time. And it provides the realistic immersive environment with new level of instructional content. The student can react with the instructor or the lecturer by using this technique. I think it might need some time before any medical school will apply this. Regarding the adaptive learning, the AI create thinking machine, the deep learning provide learning context assessment that can adaptively interact with students using the text and voice. At the same time, the learning analytics is a collection of the information, and they analyze all the information, report the data about the learners and their context, with the purpose to understand the student and to design the teaching and learning process to match with the student, particularly some individual who have some problem with the teaching and learning process that we apply. Therefore, the adaptive learning will improve the learning outcome directly or by using the technology to provide the personalized learning, and finally improve the learning outcome of any particular students. This is the crucial goal of the learning analytics that I can correct, to support student development for lifelong learning skill and strategy, to provide personalized and timely feedback to students, to support the development of important skills, to develop student awareness, for supporting self-reflection, and to support quality learning and teaching. Okay, that's all what I'm going to present to you, and welcome all the suggestions, and hopefully we can share and learn after the end of this section. Thank you.
Well, thank you very much, Professor Pasid, for your inspiring speech, which helped us better understand the impact of advanced technology on future medical education. Well, we're deeply impressed by your insights as to how to foster future physicians in the era of advanced technology. Thanks again. And next, let us invite Professor Earl Lim to give us a presentation. Professor Lim is now the Vice Provost for Teaching, Innovation and Quality at the National University of Singapore, and also the Chairman of the Executive Council of the NUS Teaching Academy. Professor Lim's topic today is COVID and other disruptors, involved or extinct. Professor Lim, please.
Hi, everyone. Thanks for the introduction and thanks for inviting me. I need to actually declare I'm no longer the chairman of the Teaching Academy because when I joined Provost's office, I had to move out. Anyway, there have been 3 chairs since then, but I'll tell you more about that later on. It's an honor and a privilege to be here. I've joined you all since yesterday, and I must say I've enjoyed the interactions and the exchanges. I'm going to share my screen now because I've been given 20 minutes or 15 minutes to talk, and as fast as I talk, I think even I can't talk as fast as I want to share all I want to share with you. So anyway, my talk, which Darun asked me what I wanted to share and what I wanted to title it, is COVID-19 and other disruptors evolve and become extinct. And that's because my good friend KK Poon said one day that if our university does not evolve, we will actually become extinct. And that's something we've actually been grappling with for the last 8 years or so. DUJIPA, for example, has been part of a sort of a think tank that I formed about 6 years ago to see how our university needs to evolve. Anyway, so NUS is a very large university. We are now 115 years old, and we have 17 faculties and schools. We have about 35,000 people on campus with about 29,000 students. So you can imagine how COVID has hit us and how it's been a struggle to make sure that the disease stays off campus and how our education can continue despite that. And in fact, where other universities have closed down, even in Singapore, and exams ended, I was tasked with helping to ensure that our education and our exams went on. So I took on this new portfolio in April, and my baptism of fire was that in February, when it became obvious that COVID was going to reach Singapore, I ended up having to plan exams and make sure they didn't run with any problems. So I'll tell you about some of these things. But anyway, what I do is teaching innovation and quality. So I oversee 5 units: the Academy, NUS Libraries, a unit called 12SEP, which is the Institute for Applied Learning Sciences and Educational Technology. And this is a research institute looking at how educational data that we have can be used to inform future decisions about education, as well as to do educational research. And then the 2 centers are the Center for Instructional Technology and CDTL. And these are our units for pedagogy that I've been trying to reshape since taking on this new job, because I feel that we really need to move not only into the 21st or 22nd century, but to the 25th century. So like I said, I had formed a think tank about 5, 6, maybe 7 years ago. And what the question was at the time was, you know, bricks and mortar universities, we've survived by being purveyors of education. People come to us and we, the experts, the masters, have people coming to sit at our feet and learn. But, you know, if you look at what's been happening in the world with things like Harvard Business School, Oxford University, and even NUS now going online with education, the question is, you know, is this the end of bricks and mortar universities? And COVID, for example, has been a game changer. So if you look at the news lately, for example, Harvard had a marked decrease in the number of students who were willing to come to campus in the first year or even to sign up. And in fact, NUS is benefiting from this. And in fact, I think that Asia and ASEAN and China will benefit in that many of the students who would traditionally go to America and Europe might now start coming to our universities. So that's the first thing. But, you know, universities like, so there's Minerva and there's Wawasan in Malaysia. These are up and comers, but I asked at a recent meeting at edX and in some other university level meetings, what is the purpose of all of these? If you look at MOOCs like edX, Coursera, do people even respect the certificates that come out? If Harvard offers an edX online degree as well as in-person bricks and mortar university degree, are people going to respect the degree online as much as they want the university degree in a bricks and mortar institute? And I think that the advantages are the interactions between people, the experiences, and the fact that we are too much to interacting with one another. So someone's got, sorry, can you please mute whoever you are, because it's quite distracting for me. Thank you. So, you know, SARS has actually reached Asia before, right? 2003, SARS hit Singapore and our whole lives were turned upside down. But the thing about it was that it was a relatively short outbreak. And in fact, although education was disrupted during that period, it wasn't as massively disrupted as COVID. And in fact, although we started looking at online issues and how online education can help us to continue, it wasn't until 2007 that we launched a mandatory campus-wide e-learning week. So for 1 week, the whole campus closes and everybody does online. And this actually helped us to ensure that we were able to run an online exam, online teaching, if ever such a thing happened as another pandemic. And in fact, we know that pandemics have happened around the world, right? SARS, H1N1, MERS-CoV, and now COVID. And we know it will not be the last. These things will come back and maybe new viruses will come out, new diseases will come about. So we need to think about the new normal and figure out how we're going to move on in education. So COVID has been a disruptor and it really has caused extinction. Already we know about newspapers that have gone bankrupt, airlines, car manufacturers, and even in Singapore, restaurants are closing, shopping centers, and our own SIA, which is like the bulwark of all things of a successful global business, has started announcing that it is cutting down the number of staff they have. So the fact is, universities will never be the same after this crisis. In fact, the ANU had to be rescued by the government, and many other universities are now talking about how we need to tighten our belts. So COVID is not the only extinction event, but there will be others, and we really need to think about how we need to reshape. So although this is a speech, or rather a talk to a group of medical people, and I am myself a doctor and a neurologist, but I think it's important to see what is out there in the world. Now, so, one of the things is that crowded anything is no longer available. If you think about lecture theatres crowded with hundreds or even thousands of students, that's going to be a thing of the past. This is Where's Waldo? And if you are like me, while I was talking, you would have been searching for Waldo. Let me just tell you, he's here. And actually, COVID has rendered it necessary for us to rethink teaching spaces. So in fact, with COVID and with new pandemics, you're going to find out how to fit thousands of students into very small spaces with the need for physical distancing. And right now it's 1 meter or 1.5 meters. What happens if you get something that's massively infectious? We are going to need to think about online and hybrid education. So in fact, learning spaces need to be rethought, reshaped, and we formed a group within NUS to look at how we need to rethink our learning spaces. About a month ago, when we started opening up again, we've been online for the last few months. We started planning for reopening of campus maybe 2 months ago. And one of the things that I have been pushing to all the vice deans and to all the teachers on campus is that whatever happens, no man must be left behind. So what do I mean by that? Imagine if you're running face-to-face classes and students come back in or teachers come back in as we used to do. Oh, I'm feeling a little bit unwell, but I don't want to miss campus. I don't want to miss teaching my students. So I'll come in, and then you spread to everyone. So we came up with a hybrid teaching model for all our students and teachers. And we said, look, this is what you do. So even if you're running classes, if you're running face-to-face classes, we help them to figure out how you can actually have classes such that you can talk face-to-face, but interact with your colleagues online. And that is something that's very important. So why do we need to do online and blended rather than just face-to-face from now on? Because pandemics are here to stay. Because our students are no longer going to be those who come into campus full-time. In fact, in NUS, we have a 20-year lifelong learning program where any student registered can continue to come back for classes. And that's something we moved about 2 years ago. And as far as I know, we're still the first movers in this field. Adult students also need to come in. International students might not be allowed to travel, or they might need to go back and might be stuck. So if they're stuck, how do you make sure education continues? No matter how Luddite you are, at the end of it, you realize that tech teaching tools are there and must be at least considered in teaching. And of course, there's this concept of own time, own target learning, where students like to do it any time of the day. And the fact that our students used to have to come in at a certain time is no longer going to be the model. And finally, in NUS at least, we have multi-centric learners in different zones, different parts of the campus. We even have several campuses. So we need to reach out to all our students at the same time. I think we also need to rethink examinations. So in fact, when we ran the exams, yesterday, Dujipa kindly corrected his comment that there was widespread cheating. What actually happened was before we started running exams, we actually wrested control back from all the faculties in that we wanted to make sure that we had an overriding view of how all exams were run. And so we started things like ensuring, we sent out circulars to the students and the teachers on how exams must be conducted. We sent out something about where we made them actually acknowledge that there was a cheating, there were laws against cheating, and if they cheat, they will get punished. And in fact, we have since punished the few cheaters that we had since then. So before we took over, there were two groups, one in one faculty with about 80 and one in another faculty with about 120. So 200 students were caught cheating, and this made the news. After that, only 88 students were caught cheating out of about 28,000 students. So it worked. But the other thing is that we taught teachers how to rethink exams. All exams must now be thought of as open book exams, and we started proctoring our exams. So that was very, very important. The other thing that struck us was that everyone was jumping on the COVID bandwagon. So we had people who actually started saying things like, oh, we can offer you proctoring solutions, but they were new, they weren't even well thought out, and they were not ready to come into Singapore. And we said, we are not going to risk our exams failing. We needed to think outside the box. And in fact, I'm now going to highlight some of the teachers who did. So this is one of my good friends. He's a physics professor called So Chong Hao. And we've been having many discussions about MOOCs and how we can reshape teaching. And what he did, based on a discussion I had with him, where I explained to him that I send my nephew boxes of chemistry and physics sets from a company called Mel Science and another one called KiwiCo. He then started doing online Facebook webinars where he teaches, and he sent out these chemical kits or rather these kits of physics tools so that the students could run physics experiments at home and on Zoom, and then they interacted. This is another chap called Sivasorti, who's also called the Otter Man because he's a worldwide expert on the smooth-coated otters. And he has been, even in the past, running webinars and online tours of Singapore. But now he has started safe distance tours, heritage tours and fauna tours where he brings them to do coastal cleanups, etc. And anyway, at the end of it, one thing that I want to stress is that no matter how good online and simulations are, one of my colleagues from science during a long discussion said to me, you can say what you want about online, but you can't train a David Attenborough, or rather you can't train a biologist by making him or her watch David Attenborough movies. So, you know, one of the things that was quite distressing to me, even though I think it was necessary, was that around the world, many schools graduated their medical students early and let them go out to help fight COVID. Now, this is great, but no matter how we think about our students being well-trained throughout the 5 years or as many years as you have, I think it's important to remember that the final exam is actually, at least in Asia, really a summative assessment, and at the time when all the students come out with their integration, etc. So I really am very uncomfortable with this. You know, someone told me that, medical students are now taught online entirely, the simulations, etc. And then my colleague sent me this photograph, you know, your x-ray showed a broken hip, don't worry, we fixed it with Photoshop. And that reminds me that you really need the high touch of patience. And in fact, you don't want students to be trained not to be able to handle an infection, a pandemic. If you only know how to be a doctor, but you don't know how to wear your protective equipment, etc., that's a disaster. So I'm very happy that our medical school has been thinking about all these things. This, by the way, is how you redesign a human being to survive a crash. And we really need to rethink our design. So some of the things we are pushing out now, adaptive learning, which the previous speaker mentioned. So we are talking about how you can take all the rubrics, the blueprints within our different medical schools, dental schools, and all the professional and non-professional schools. Look at all these data points. We call them knowledge units or skill sets or whatever. And over the course of the years, how can you take all these competencies and then design a computerized adapted learning and teaching and testing system such that you can take the students who are doing well and let them accelerate their knowledge so that they finish the essential modules fast and then can learn other things or maybe even accelerate their graduation. Whereas for those who are doing badly, you remediate them and you help them to understand what they need to do so that they get competencies. So we are now in the midst of, I tried in the past 5 years to collaborate with various universities, but as time has gone by, I've realized that it's not going to work. You are going to need to do something that is suited to your own group. And last night we had our final pilot meeting, and we're now actually going to launch the collaboration. And this is going to need a lot of our teachers to come together and actually be willing to blueprint. And I'm actually very proud of our medical school because even 10 years ago, we started blueprinting. And I think this was something launched by Ko Darun, where we were insisting that all our teachers must blueprint, must assess the skills, and then make sure for every assessment, every exam, every test, every interaction with a teacher, you actually acknowledge the skills. We're now in the midst of redesigning our thinking spaces. Let me just show you a few things. This is our Imaginarium, which I launched about 3 years ago in our library, where you go into a space and you can actually try out different tech tools. The thing though is that no matter how good all these things are, and forgive me that this is running so fast, I don't know if it's slowed down on your computers, but despite all of that, you realize that actually in COVID, in a pandemic, you can't go in. You have to think about how you can clean all your devices, and you can't even go in face to face. So there are other things that we are thinking about now. For example, this is a module that is done by Marian Au from medicine and Hu Shijia from our dental school. And this is a VR scenario as part of a MOOC using Google Cardboard, where you can see on your phone what it is like to be a kid. Below this is Alfred Cow's module on surgery and how you can use VR. And again, this one is using Oculus Rift, but we can easily use it such that you can view all these things on your own phone. So that at least eliminates the need to meet in person and to do all these things with devices that might not be clean, right? So, sorry, I need to move on. So NUS has joined edX, and we have been running online courses. We now have 7. My intention is by the end of the year, we'll hit about 25. They're already being recorded. And by next year and the following year, I intend to hit 100 MOOCs from NUS. Different fields, our best teachers showing what they can do. I think we need to rethink education as well. So this is a move that we started about 1 year ago, where we have we encourage our teachers to use other people's MOOCs. And if you look at the bottom left, you see that we have MOOCs from the university on edX, and then we create something called After the MOOCs, or we create a hybrid of videos using MOOCs from 1 or 2 MOOCs, or we create our own MOOCs from NUS, and then we have After the MOOCs. So this video shows an After the MOOCs where this chap called Liu Qizhang from business school teaches our programming. And after they view the Harvard course, he then has these After the MOOCs where the students ask him questions or he notices mistakes that they've made, and then he pushes answers out to them. So it's a real iterative discussion process. I'm actually going to end very soon. This is actually something we are launching in 2 months. It's called Genius Channel, where we have both Genius books and Genius videos, Genius talks. So Genius is a name, not because we think we're geniuses, but because we're aspiring to be geniuses. And of course, it has the NUS in it. So forgive me that it is so tacky, but anyway, the idea is for people to just have ad hoc opportunities to show videos every time they encounter a teaching opportunity. So you can imagine if you're alone in clinic and you see a wonderful patient or a wonderful x-ray, we will help you to even anonymize the patient so that you can't identify the patient. And then you can also record something there so that your students can see it. And we are allowing teachers to either make it available to the world or only to make it available within NUS. So this is my last slide. You know, as we talk about extinction, we must also think about evolution. And we must think about moving from being the caveman Luddite who only knows how to stand on a podium and talk to the world to being somebody who might still do that, because there's a lot to be said about the Socratic method, but it's also to be technologically savvy, because in the future, we will need to be savvy. So with that, I thank you. My last slide was just a thank you slide. Thank you for your attention. I'm done.
Well, thank you very much, Professor Lin, okay, for such an impressive talk. Okay, again, okay, we really appreciate your sharing with us your valuable experiences from National University of Singapore, which is certainly very helpful to all of us, especially in this special moment. Now, next comes our last speaker, okay, in this session. Our last speaker is Dr. Ada Rosita Tanji. Dr. Tanji is a consultant of regional anesthesia who has great interest in simulation-based medical education and anesthesiology. She's now the head of Simulation-Based Education Research Center. And the title of her topic today is, Simulation in Future Medical Education. Now, Professor Tranti, please.
Thank you so much for a very nice introduction. I'm Ida. Today would like to share about the future of simulation. Okay. Okay. Is my screen can seen clearly from there, Professor? Okay.
Yes, we can see it clearly. No problem. Please.
Okay. I'm come from the Simulation-Based Education and Research Center Universitas Indonesia in Jakarta. we are there are two towers in our university, and one is the education tower, and the simulation-based education and research center is occupied two floor in that education tower. So we provide the high fidelity and the low fidelity mannequin for simulation. We do simulation for our medical students, but also for sometimes for health professional in our university hospital. So I like us to think about what can we learn from this pandemic, this COVID-19 pandemic in simulation. Before this COVID-19 pandemics, we also have already, experienced other epidemic also, and pandemic maybe in our friend in other country like the Ebola that's in Africa, and we know that simulation was successfully utilized there to improve the healthcare system and professionalism preparation, like how we can do development and deployment of the readiness training, how to make a hospital preparedness. Simulation play a major role in that. And maybe we not forget also in 2006 until 2009, there is SARS epidemic also in Singapore and in Asia, especially Hong Kong. And simulation also used there and have a major role also. They use simulation for training and change protocol during the outbreak of the SARS, and maybe also how to manage the airway, to decrease the aerosol production that we suspect that we become the media of transmission. And how about the COVID-19 and medical education? Until now, the COVID-19 pandemic is not finished yet, especially now in Asia. And if they say that it will come in wave, some country experience second waves, and I hope it can be sooner will be end. But for us as a medical teacher, the pipeline of educating healthcare professional should remain intact, and that should be a big challenge for us. And all universities across the world have transitioned to continue education through online or virtual means. All other speaker has already told us how they move the traditional teaching method to the online or virtual means. And for the last year, medical students, they have to cancel their clinical clerkship. And medical students, majority move away from the bedside training, and which we also know is a vital component of undergraduate training, move it to the virtual and online learning. But we all agree that students need to develop minimum skills, which is underpinned by the curricula. And that's not only the technical skills like cognitive or psychomotor skills that we can give some miniature, they can do it, or maybe we send them some mannequins and they do at home how to inject or doing some procedure, and we watch through the web-based platform. But they also must learn the non-technical skills, like how to do teamwork, how to develop the leadership, and how to develop communication between his college or between other profession, and move all the platform to the online or virtual means it's not helping our medical students. And what happens, as we all know, that simulation are typically suspended or deferred during pandemic because simulation usually involving physical interaction among the participants. The medical students, the postgraduate students, they must interact each other, and that's what we what make the authority, the dean and all the university decide that simulation must be suspended or deferred during pandemic. And then simulation also not a high stakes examination for our student. Usually we use it in formative assessment, never use it in summative assessment for our medical students. So it considered as less important. But we all know that the value of simulation can be ignored in medical education because it provides a crucial means of training and updating clinical skills without compromising patient safety. And also it offers a protected environment in which participants can learn from their error. And of course, the most important thing I think is the realism, the replicate of actual clinical scenarios. So our medical students not only learn the skills, but also how the effective part of the learning, and that include the communication and interprofessional team-based skill. So that make us choose which one we will choose in our university. Is it we use a well-trained if we have a well-trained medical students which know how to use the PPE in a right way and do the infection control in a good way, or we choose to protect our medical students from their contact with patient or maybe with their colleagues. And simulation programs must be continued. And during the COVID, we know that the simulation program for undergraduate had been stopped, and but slowly after several months of the COVID-19 outbreak, we slowly started our simulation for the undergraduate students. It's the pre-internship module. We do teach them in emergency and critical cases management, but especially in COVID-19 patient. But there are some adjustment that we do use for the simulation. So we hope that it can ensure our student safety during the simulation. And of course, for the postgraduate in pandemic outbreak, we do it so because we needed to create our students who still work in the hospital during the outbreak to know how to do the airway management, how to do resuscitation when wearing the PPE, and how to manage a severe acute respiratory distress patient. And that's made the simulation has shifted from only a back burner training to choice of strategy to ensure the individual team and system readiness in pandemic COVID-19, especially for our postgraduate students. And during the outbreak, we continue or do simulation with some adjustment, like I said before. One is we do rationalizing the training needs. Our simulation center is usually full from Monday to Friday, full of the medical students, postgraduate students. But now during the outbreak and the national regulation that mostly of the technician must work from home, and only few of them who come to the university to run the simulation center, we must adjust the number of the training needs that perform in our simulation center. So we choose which one is the most important thing. And we know also that the teacher or the one who will lead the simulation is also must do some clinical work also. So we must preserve the clinical manpower and resources also. And so we choose which one is priority to our students, staff, and patient safety. And we do the resuscitation simulation training with added infection control, the correct donning and doving of the PPE. And I think that this is also very important because during working, the donning and doving usually the wrong way to do donning and doving will increase the risk of infection, and of course, effective communication and teamwork. In light of the limitation to visual and audiovisual audio fields when they are using their hazmat. So this is several training that we done. And for undergraduate, we postponed it, and the assessment or high stakes pre-life science training that we to produce more healthcare manpower generation, we do it. So we need more manpower, more healthcare profession to deal with the COVID-19 patient, and we cannot postpone the examination. So we still do the OSCE or maybe simulation examination, formative examination for the last year medical student and the last year postgraduate students. And there's more modification also. We minimize the physical contact time. So we do the flipped classroom like the other speaker has already told us. Before they come, we give them the material through the web-based platform, the video of it, and then we do the video conference platform, usually discuss the briefing or maybe discuss something that they want to ask before or after the simulation, and maybe they can try it also do this simulation at home by like the ophthalmology residents, they do it with the goat's eye at home, and the teacher is inspect them from the Zoom platform. And we restrict the class size. Usually there are 40 until 50 students once in when we're running the skill station and the simulation. So we limit it until on maybe 20 students, and we divide it in small rooms with only three person in one room, which is 2 students and 1 instructor, and with social distancing and other infection control measurement. But of course, we know that our method is maybe not as we expect for the students' needs. So we do the research also. Now we still performing research to compare the conventional insight to simulation-based training. So we bring our high fidelity mannequins to the intensive care unit, and then performing the conventional insight to simulation there, and compare it with the hybrid web-based training in COVID. In hybrid web-based training, where the student take some part of it as a web-based training, and then do it in the insight to simulation. And we compare it in the management of respiratory distress management, and the outcome that we research is the non-technical skills like communication. How do they do to the teamwork? How can they manage the work? Can they finish the task as we expected? And this is also interprofessional collaboration. So we include some nurse also in this group, and to measure how the students, our postgraduate students, can communicate well one another. This is one of I take from a journal from the advent of simulation. So to know when can we start our simulation again. So if there is no cases or only a few of imported cases, we can continue training. But if there is sustained local transmission, so there are several precautions that we must use, like continue only the selected essential training like we do. And also the most important thing is commence training for the pandemic preparation, like how to do the airway management, how we do the respiratory distress, ventilatory management, and then we can also how to do resuscitation when they still using the PPE. So the faculty and participant also must do the travel declaration, and then if they're feeling unwell, they should should not be attain the simulation. And this is also the same like the other table, but we make it in the in the other forms. So if there is epidemic or pandemic declare, so we wait for the decision of the authority. Is the medical school will be closed or still continue? If it will be closed, so all of the activities will move to the web-based learning and video conferencing only. This is what we have at the first pandemic during February, March, and April 2020. But if the authority decide that we can open the medical school, like mostly in our ASEAN country now, the medical school is slowly open, so we can start continue for clinical teaching. We can do the role play simulators, but we avoid the patient contact, so we can use patient standard, or maybe we can use virtual patients or other means also. And we can use also other technologies like other speaker has already told us, the VR technologies, or maybe the hologram technology that maybe in the future will come also to us. And of course, the COVID-19 pandemic has hitting us badly in medical education, especially in postgraduate students. They say that the case is decreasing, the case volume is decreased, and our students is lack of experience in management of patient. And but also the pandemic also shift the bedside practice to simulation-based education. We see that in orthopedic or maybe in the intensive care unit, they use the in situ simulation, and then from the ophthalmology, they also use the simulation. And I think that the simulation play a more important role in postgraduate students during the COVID-19 outbreak. And how about the post-pandemic setting? So if we pass this pandemic, simulation will still play the role and also expand his role, especially in the disaster preparedness module. In Indonesia, our students have a special module called disaster preparedness, and we teach them how to manage like volcanic eruption, or maybe earthquake, and maybe other like tsunami and other disaster. But after this pandemic, how to manage the outbreak of infectious disease will be added to our disaster preparedness module. And also the infection prevention, infection measurement control, it will be added also for our medical students and postgraduate students. And this also need simulation also. And dealing with COVID-19 patient, how to do average management or initial management of COVID-19 patient will be added also in the curricula. And also how to keep a good hospital system, how to manage a hospital flow, and to provide the logistic. Like I have said before, that simulation still will play a role in surgical skill simulation based training, because we have moved from the bedside teaching to simulation based education majority for the some clinical skills, and also the non-technical skills, especially simulation play a very important role in this. As the conclusion, I can say that the COVID-19 pandemic emphasized the importance of simulation even more. So it not hit us, it not defer us, it not make the simulation extinct, like Prof. Eri before say, but it emphasized more the importance of simulation. And simulation during and after a pandemic can be carry out with certain adjustment and modification, and we must be very careful if we run this during and after pandemic. And post-pandemic, the role of simulation and medical education will furthermore combining with certain technology methods like virtual reality, VR, or other holograms, or maybe other web-based platform. Okay, I think that's all from me. Thank you so much.
Well, thank you very much, Professor 20, for your nice presentation. Certainly, clinical simulation is having a significant impact on medical education, especially now when we are faced with the challenges posed by COVID-19 pandemic. Well, thanks again for your sharing with us your experiences and your vision. Well, time's really running out. Okay, we are a little bit behind the schedule, but still have 3 minutes for Q&A. I think there's a question from, let me have a look. From the chat box, there's a question from the audience to Professor Pasi from Sirira Live Channel. Let me have a look at the question. Here's the question for Professor Pasi. Could you please give us a few minutes? Oh, sorry. I cannot see the question now. Now, who has asked that question to Professor Pasi? Could you let me know?
I have in my hand. Can I read it?
Okay.
Okay.
Sure.
It's from Dr.
Please.
Putu Sudayaba from Indonesia. The question is, how could we arrange effectively during and after pandemic global condition that like warning signal to reform our strategic model, especially for clinical practice in medical education? So that's the question. I would like to take a response. First of all, we are now conducting some a survey. In fact, this year, our 6th-year medical students, they had about 4 weeks less than usual time to gain the clinical experience before they graduate. So we would like to see whether this 4 week less than usual will affect their clinical competency. We are now sending off questionnaires to the hospital that they are now working in. I mean, when they finish the 6th year in Thailand, it's compulsory that all the medical students, they have to spend 2 or 3 years in the district hospital. We're now sending off questionnaires asking the director of those hospitals whether they have any lacking of competency for those who graduate this year. For the 4th year and the 5th year medical students, although they had less time for clinical clerkship during the COVID, but we can compensate it, next year. I don't think there will be any problem, but we need a survey and also the observation whether it is as what we expect or not. One thing that I think we can do in order to send out the message, we are now having the established China ASEAN University Consortium on Medicine and Health. If we have, for example, the platform that we can share and learn from individual medical schools, particularly how we improve the clinical competency if there is another crisis again or pandemic again. What kind of learning method that we should use in order to maintain the clinical competency, and then summarize the suggestion and then present to the world. This is the summary of what we have done. The 45 medical school, I think this is significant if we can share and learn and send off the conclusion that we can do.
Well, thank you very much, Professor Pasi, for your answering that question. Here, I also have a question, maybe one more question, okay? Here's a question from Dr. Let me have a look. In the chat box to Professor Pasi again, okay, from Dr. An Lao Kong from Laos. Here's the question, okay, if case volume is reduced during COVID-19 pandemic period, what is the best way to maintain the skills and knowledge of residents in the country with a low resource setting?
I would suggest we might need to have, for example, we send off our students. I mean, in Thailand, there are some shortages of patients in some district hospital, but also more patients in some district hospital. We send off students and to spend their time in some other hospital to gain clinical. Particularly in some area in Thailand, there are no COVID cases at all. We send off our students there. So I mean to shift the place where they can learn clinical competency. And the place here mean maybe not only the place in the country, but maybe in another country nearby, if possible.
Well, thank you very much, Professor Pasit, for your answer. Due to limited time, okay, I think I have to close the session now. But I do hope we have more chances of this kind of exchange in the future. And last, let us thank again, okay, the 4 speakers of this session. Thank you all. Thank you.
Thanks so much for our distinguished speakers. Then we will move on to the second topics, student journey, safety, mental health, economic problems. And we are pleased to have Associate Professor Rattapon Tuangthong, Faculty of Medicine, Surirat Hospital, Mahidol University, as the chairman of this topic. Please welcome Associate Professor Rattapon Tuangthong.
Hello. Good morning, everybody. I would like to thank you for joining this webinar. Today, I would like to introduce the first speaker, Dr. Kawai from Chinese Academy of Science, Peking Union Medical College. And she is specialist in infectious disease, especially for HIV. And she also worked in Wuhan from February 2020. We welcome Dr. Kawai for talking about the medical student in COVID pandemic, challenge and opportunity. Welcome. Dr. Kawai, are you here? Okay. Hello? It's okay. If not, I would like to move to the second topics. First, I would like to invite Professor Owa Emilia. Dr. Owa Emilia, she is the Dean of Faculty of Gajah Mada. She is the first Indonesian professor in medical education. She also be an obstetric and gynecologist. Welcome her to talk with us about looking at the life of students during pandemic. Welcome, Professor Owa.
Hello.
Hello. Morning.
Good morning.
Good morning.
Thank you very much for the opportunity. So today I'm going to share with all of you, professor and also all colleagues from different countries about how our students experience through the pandemic situation. Can I share the slides? Yeah. Okay. Can you see my slides?
Sure.
Can you see my slides?
Yes, we do. We do.
Yes.
Okay?
Yes.
Okay. Okay. So I will focusing on how the students experience during the COVID-19 pandemic, and also how they cope through the pandemic, and in terms of how they adjust in terms of life and also their learning of activities. And of course, for the pandemic situation, there are two things that is we can learn. What the students see is, one is how they adaptations during the situation. So since early March, where the country already have the large-scale social restrictions. So since that day, early of March, so all the daily life, including the academic life, is changing. And the second is about the changing of roles. So students, as not only they have to survive as students, but also here the students is also seen as the agent of change since early of their life. So they have the real life situation problems that they are also one of the big team, and in facing this pandemic situations. So since the 15th of March, where we have the regulations in our university that all academic activities is redesigned and rescheduled. Like, for example, if I take the clerkships in the hospital is redesigned. So students is restricted to go to the hospital. So they can go, but only every week, perhaps only 2 times. Yeah. And they can still have exposure with the patients, but the other activities is continue with the online. And the second is all schedule is reset to avoid fatigue, of course, and also gathering of many people. And number 3, for hospital placement is discussed and negotiated with the prime attention, of course, for the safety of the students and also everyone. Yeah, that's related with the hospital business. Number 4 is the faculty and hospital also have to provide the PPE for students. This is also one of the challenges and expectancy of the students. And number 5 is training and preparation for teachers and students, because as we know that not all students are prepared, and more the teachers also not prepared for these situations. And number 6 is finally on 19th of March, we have provide the guide for students and teachers. So in how to do the teaching, learning, etc. And what we see as the roles of the student here. So we prepare the students to not only how they adjust themselves in the new situation, but also how to help others in these situations. So they are prepared with knowledge about COVID-19, but also they also prepare as educator for the people, yeah, for public literacy on COVID-19. And they are also active in public campaign. So they are involved in public campaign that is designed and coordinated by the university. So here actually the students have involved in early exposure to real problems. And this is one of the good things that we learn from that students learn from the COVID period, yeah. And also, they also feel that there is an increase of public trust to students. About the adaptations in learning, then what they feel is they have to prepare learning support. So since the beginning of March, they have to look at about the internet connection, for example, especially if they have to go back because the parents want them to come home, yeah. So then they also have to look for the internet connections and also make sure that the connection is not weakened, yeah, during the learning process. So this is all the things that they have to prepare. And they also have to follow up the informations on COVID-19. This is also not only for them, but also this is the survival strategy that we emphasize that you have to know before you help others. Number 3 is about the sensitivity. So because everyone are in risk, so we need the students understand about self-safety, but also how to being involved in the caring of the other people. So like, for example, how to do the prevention and how to help them, yeah, to inform the community about this prevention strategy. And the other things is increase creativity. So like, for example, finishing task for skills and also how to give live report and recording. And this is also a challenge for the students that they have to keep their motivations for distance learning because it is a quite new things situation for them. And so for the online learning process, so this is also very interesting because when you look at the online learning for students, it is can be good or not good experience for them. What I mean is they're happy because online is their life. So it is a millennial community, and they are also happy because they can learn from everywhere. They are from home or from everywhere, and they find that it is efficient, and they also feel that it is creating closer. For some students also found for transmitting knowledge, it is more clearer for them. Yeah, it is clearer, so it is good for knowledge and information. And from our experience, the online learning for students for the knowledge domain is not interfere with this kind of method. Yeah. So but also there are some of the students also not happy if they have a challenge in the online connection, for example. And for the teachers, the online learning is actually a challenge, and they also have to learn and adjust with the new situation. But also some of the younger teachers feel that this is very entertaining because they can motivate them to increase creativity for online learning. Yeah. The other thing is about the online assignment, which in the beginning is a problem for students because teachers tend to give lots of assignment, which is overwhelming for students. But I think this is because it is not being blueprinted or being pre-planned before, but now is becoming more manageable, and I think is more reasonable for the students. Yeah. And then the other is the students feel that the schedule is more compact. What I would say that actually the schedule is not changing. Yeah, it's similar. So the load of learning is similar, but perhaps the rescheduling of the session is very minimal or none. So it seems that it is very compact, yeah. And perhaps some students also feel boring because it is since the morning, 8 o'clock, perhaps until in the afternoon, they follow in front of the computer, and it is also boring for them. So they feel that it is more compact. And the other thing for the practical learning, of course, that we taught them through online with creating more video. It is good for them, but also for students, it's not satisfying. For the research project, of course, there is some students that found that they have to readjust the plan. Yeah. So like, for example, if they have data collections in the field, so they have to readjust the plan. And some of them also can change to review, yeah, for the similar topic. But then also the good things for the research project, the consultation is much easier. Yeah, they found that they are easier to find the supervisor because supervisor is perhaps less of going traveling, so it's easier to find them online. Yeah. Also, the online seminar, the schedule is easier to be adjusted. The other things is, I will show you more about the community service that the students involve. That actually we have compulsory program, what we call as the community and family healthcare, which is through interprofessional education, where the medical school, students also learn with other profession, that is nursing and also the nutritionist. And they work together in a group and assign to several families. And here the student have an assignment to improve public literacy. And they found that it is very useful, not only for them learning how to approach the community since the first semester. So since very beginning, of course, that the assignment, the task is not the same for the junior students compared to the more senior one. So the program is very useful, and they found that they can give information, yeah, in the beginning, and also they give educations and even like exercise, yeah, for the family, and discussion about what happened involving COVID, yeah. And they also create what they call it as a hotline link. So if the community have problems or something to ask, then they can ask this group of students, and every group of students have their own like supervisor. So if they don't understand or they don't know, then they can consult to the supervisor. So this is very important and interesting for them. And even they also taking this kind of activities in their own environment. So because all of the activities are online, so some students not stay in the city, but stay in perhaps different province, different island. So they also spread this activity to the surrounding environment. So this is very good, and some students also reporting about these activities. And all done with online, and if they go directly to the community, we recommend it with protection, yeah, with protections, of course. And I think these activities really give students more like a feeling of confidence since the beginning, that they can do something for the other people. And this is make them happy and also feel very motivated with this kind of activities. And sorry. And for the student activities, so students also still organize several extracurricular activities. Of course, all are done with online. And I can mention here that students like to do the clinical updates, webinar, and also they also do some support activities to support each other. So like having the online workshop for healing, mental session, or any kind of problems that faced by the students. Also, they also have the discussion forum with the dean about the feedback on online learning. So we learn each other. The interesting thing also, the students organize of collecting donation for students, from students to students. Yeah. So some students who have difficulty in purchasing, like for the internet package, then this is also helped, yeah, by the other students. So this is interesting. And also they do the essay competition. So not only for the internal, but also for external university, and also several online discussion. And what support that is appreciated by the students. So they feel that the faculty already support many things. Like, for example, try to modify the curriculum. Yeah, the curriculum, so it can be still carried out during these difficult situations. Also we prepare learning media for online learning. So we, in a very, I think we call it very short time, we also creating a studio and also clinic for teachers for creating many media for online learning. Also, online consultation support if they have difficulties about anything here. And also the faculty give the logistic support for students, especially students who cannot go back to their home. And we give like not only for foods, yeah, but also some money for their living, yeah. And also support for internet package from the faculty, university, and donation for students, yeah. And support for personal protective equipments that is regularly distributed by the faculty. From the university, also give a strong support, especially for health protections. So for screening and tracing is organized by the university, and all students are included in there. Yeah. And also online support, like for psychological service. This is in collaboration with the Faculty of Psychology. And also provide accommodation for students. So some students who perhaps being rejected by their house, yeah, I mean housing. So we provide them with accommodations during the difficult time. And also policy fee reductions, yeah, for all students. So this is some of the service for psychological problems that provided by the Faculty of Psychology in collaboration with all, I think for all faculties, yeah, like online service with close accompaniment for students, and also they recruit peer counselor, so from students to students, and they also very active in posting motivational message to help easing the students from this difficult time. Of course, there are some worries that is expressed by the students, that they worry if the facility for learning is not functioning. Like, for example, there is a weaken of the connections, yeah, or interrupting of the connection during the learning process, or they also sometimes worry about the not comprehending the learning materials, especially for the skills part. Yeah, skills part. And they feel that they also a bit worry about the decrease in the academic achievement, which I think already presented by other presenter from Gajah Mada. We also conducted research on this. And they cannot do research, of
เขาเหลือ
course,
กี่สไลด์
and
ครับ
some psychological problems,
ไม่ดูนะ
stress, yeah, is also increasing, and some also worry about the health problems, yeah. So I think now more and more young students, young generations are very active in like cycling or sporting, yeah, in the morning, yeah. And community service not reach the target, and decrease creativity and social sensitivity. These two is because the decrease of the exposure, direct exposure to the community. So the activity is there, but is not directly contacting or communication with the family. So, but anyway, they things have to still have to run, yeah. And I think we'll never go back to the normal. So this is the time that we learn how to align people. So like how to realign people, yeah, realign schedule, replan the resources, and also the changing culture in our institutions. I think everyone have to learn from this situation. I think that's all. Thank you very much for attention.
Thank you so much, Dr. Owa, for sharing our excellent life from Gajah Mada. For the next speaker, Dr. Shao Wai from China, from Peking. She will talk about the medical student in COVID-19 pandemic, challenge and opportunity. Welcome, Dr. Shao Wai.
Thank you. Thank you for the introduction. Can I be heard this time?
Yes, please.
Yes.
Yes.
Okay, sorry. I'm just experiencing one of the common problems in online education, the internet problem.
Yeah.
So let me first share my screen.
Okay, please.
Okay, thank you for the invitation, and I'm very happy to be here to stay with all the distinguished guests discussing the problems and opportunities of medical education in this epidemic. I'm Dr. Qiao Wei. I'm a physician of infectious diseases. I spent about 2 months in the epicenter of Wuhan in China, and then since I come back from Wuhan, I've involved in online education. So today I'm going to talk about a few aspects that we have noticed during the online education, and I hope that can start a discussion in our audience. So a very brief timeline of the epidemic in China. The first case was declared in December 2019, and then the first confirmed case outside China was January 13th in Thailand. In WHO then declares global emergency and pandemic till March. And since then, the global cases have been dramatically increased. Although the epidemic in China has been greatly controlled right now, we're still facing the problems of imported cases. And since January the 23rd, as you may heard, the Wuhan city was locked down, and then the whole province of Hubei. And that nearly marked the closure of most of the schools in China, including high school, colleges, and universities. And with the improvement of the epidemic, the reopen of these schools were carried out in a step-by-step manner between May to September. And right now, this September, nearly all students in all parts of China has returned to their school, which may bring us new problems right now. And during the epidemic, till mostly in the spring festival, in the spring semester, over about 70 million medical students in China continued their study at home during the epidemic, basically from online studies. And if we look at China as a whole, the impact on education was dramatic. And as stated of the head of Ministry of Education, it presents an unprecedented large-scale online teaching experiment for China and also for the world. As China was the first country to experience the epidemic, the first experiment of online teaching was also started here. So basically, we are integrating different online education skills. And according to the data from the Ministry of Education, as of May 6, about 1,454 colleges and universities over the nation had launched online teaching. And altogether, 1 million teachers gave courses online, including both theoretical and experimental courses. They covered all the disciplines of undergraduates and graduates, and about 70 million college students has participated in online teaching. The teaching mode has been varied, including live recorded broadcast, MOOC, and remote guidance. And experiences from PUMC, Peking Union Medical College, the college where I stayed. In the spring semester, we have a total of 793 teachers, gave out about 160 courses during this semester, which accounts for most of the original courses that we have on site. And altogether, over 2,500 medical students took online courses for a total of about 13,000 person classes. And the patterns of teaching included live recorded broadcast, MOOC, and WeChat, which is a characteristic in China here, discussion group that helps a lot. However, problems exist. One of the first is that the on-site internship, whether of surgery or other department, has been suspended, which was a big impact on the rotation of these medical students. And also, some have noticed that there is a decrease in class discussion quality and quantity because all the activities were carried on virtual classes. So without face-to-face communication, students may not like to present themselves to the teachers, and the communication may not be that direct. And also, both the teachers and students have noticed that great efforts are demanded in interacting in virtual classrooms, especially in clinical case discussion, problem-based learning. For example, usually in the classroom, we can use the blackboard and pencils to continue the discussion of the cases. However, in this situation, we can only use the slides to present what we think and the think flow of the cases. So that may present a problem for active learning in virtual classrooms. From the students' perspective of online education, we actually did a survey after all the students has returned to school. There is a very popular cartoon on internet since the epidemic, which is very funny, that doctors in 2030 will be like to feel difficulty when he will be presented a case that he learned during the epidemic, which in some extent tells that the differences of online teaching and on-site teaching. However, we have tried multiple teaching skills to shrink these limitations. And from the survey of our undergraduates and graduate students, including 209 undergraduates and over 400 graduate students, both groups prefer on-site studies as a base and online as a supplementation. And when asked about the suggestions of post-epidemic teaching, most students will choose to use on-site studies as usual, but online studies can definitely offer a supplementary methods for this kind of teaching. So from this survey, we can see that most students, no matter the undergraduates, neither the undergraduates or the graduate students, still prefer on-site teaching or bedside teaching instead of online teaching, which let us think there is still a long way to go to make the online teaching as the same quality and quality with the on-site teaching. So to shrink the limitations or shrink the distances from online teaching to on-site teaching, we use multiple teaching skills to facilitate and to guarantee the teaching effects of the students. For example, teachers will use different models. Here is an example that Professor Lawrence from Yale University of Medicine was giving a lecture during the epidemic, which talks about the anatomy of normal human gait. He used a different
I think it have some internet problem a little bit from Dr. Shao. Okay. Dr. Shao? Okay, I would like to break a little bit for Dr. Shao, and if possible, I would like to move to the third topic from Sirirat Hospital. I would like to invite Dr. Thidarat Burana Chaikiri. She is a child and adolescent psychiatrist from Department of Psychiatry. Today, she will talk about hearing student voice in COVID-19 pandemic, stress and support necessity. Welcome, Dr. Thidarat, for talking.
Thank you, Professor Ratthapol Tongthong. Good morning, everyone. Let me share my screen, please.
Dr. Thidarat talk, I will come back for Dr. Shao. Okay? Okay.
Okay. Good morning, everyone, again. Today, I'm so glad to be here presenting to you all about stress among medical students and the needed support. And thank you, Professor Ratthapol Tongthong, for providing me this opportunity. In the next about 15 minutes, I'm going to share the result from our multi-center study, collected the data from Thai medical student. So here is the outline for today. We will talk about the demographic data from the study, the level of stress among medical students and related factors. What are they stressed about? What type of provided support, and are they satisfied with the support they receive? And the last one will be the support the student need more. So our team, about the objective of the study, our team would like to study the level of stress among the medical students and the support that they needed. So we created the online survey during the COVID-19 pandemic, collecting the data from June 16th to August 31st, 2020. Due to our 6-year curriculum, and at the moment, the first-year student had not started school yet. So we collected the data from the 2nd to the 6th-year medical student. Recruiting from 11 medical schools, which represented all 6 regions of Thailand. The total participants are 1,332 students. We included all size of medical schools, small size, which have less than 250 students, medium size, which have 250 to 1,000 students, and the large size medical school, which have more than 1,000 students. Most students or about 60% of the participants were in the medium-sized medical school. And here is the demographic data. About 60% were female. 56% of the students were in preclinical year, while 44% of the students were in clinical year. Almost 90% of the students are Buddhist, and 5% of students have psychiatric disorder. During the time we collected the data, half of them were living at home, a quarter of them living on campus, and the other quarter of them living off campus. Now we are looking on the level of stress. We use Thai Perceived Stress Scale 10 or TPSS 10 to assess the stress level. Our study found that during the COVID-19 pandemic, the students were in the higher level of stress compared to previous data collecting in medical students in 2010. As shown in the table, we can see that the mean score of TPSS 10 during the pandemic was around 19 compared to 13 in collecting in medical students in 2010. Other than that, the level of stress was almost the same as the level of stress of depressive disorder patient. As we can see in the table that the score was 17.76 in our study during the pandemic compared to 17.33 in depressive disorder patients. So the level of stress is pretty high. There are also several associated factors that related to higher stress. We found that being female, having psychiatric disorder, have no social support, lower family income, and being in small size medical school were all related to higher stress with statistical significance p-value less than 0.01. So what are they stressed about? That's interesting question. So here is the top 10 issues of stress they reported. Fear of system failure during the exam, uncertainty of teaching and learning arrangement, lack of clinical experiences, unable to learn or study effectively, lack of practical experiences. We can see that most of the issue of stress that show in this table were related to changing in learning and teaching system. Changing the learning system into online platform created a lot of stress. Many of students talk about the concern on the instability of internet connection, both for student and teacher side, not having enough teaching material, electronic lecture, learning system to support online learning. Crowded class schedule, home environment that not suitable for online learning. Some student, it's very noisy at home. The nature of online learning itself that may require more attentiveness, lack of interaction between teacher and student or between students. All this concerned causes by the changing of learning system caused frustration and stress about their learning efficiency and academic achievement. The changing into online examination also caused stress about system failure due to unstable internet connection, or someone may cheat on the test. Another concern was about lacking of clinical experience or practical skill. And the last issue was about not being able to meet any friends or attending any recreational activity. I think this this information quite consistent with Professor Ova presentation about the stress among the medical students. So what type of support are provided in medical school? So here is the top 5 types of support provided from medical school, grouped by the size of medical school. Most of the schools have changed their teaching and learning system, the grading method. They also provide financial support, infection prevention equipment. Some of them provide mental health care system. While we looked into different sizes of medical schools, we found that small size medical school had less support in the aspect of mental health care system, equipment for online learning, and the changing of grading method compared to the large or medium-sized medical schools. So the interesting question is, are they satisfied with the support? When we look into the preclinical or clinical year, we found that preclinical year medical students were more satisfied with the support than clinical year medical student with statistical significance. And around 90% of students were quite satisfied or very satisfied with the support. In terms of the size of medical school, students in large size medical schools were more satisfied with the supports than in small size medical schools with statistical significance. And now we came to the last section about what support do they need more. According to the preclinical clinical year, in preclinical medical student, they need more on stress relief, activity arrangement, financial support, mental health care system. In clinical year medical student, activities to enhance clinical experience came into the first place, followed by stress relief activity arrangement and mental health care system. We can see that stress relief activity arrangement was ranked in the first place for both preclinical and clinical year medical student when exclude the need for clinical experience aspect. In terms of the size of medical school, stress relief activity arrangement was ranked in the first place for all size of medical school. More than that, large size medical school may need more support to enhance clinical experiences, while the small size of medical school may need more mental health care system and financial support. We also summarize the students' response for other needs, optimizing online teaching and learning methods like efficient internet connection for both teacher side and student side, announcing clear teaching and learning guideline in advance, electronic lecture allowing students to review the lesson after class in case of unstable internet connection, not too crowded class schedule, and not too much assignments, and handing out teaching material. Listening to student feedback is very important. Tuition fee and housing fee reduction, allowing students to move into school dormitory if necessary. So the conclusion from our study are the medical students were in high level of stress during the pandemic. Being female, having psychiatric disorder, no social support, lower family income, and being in a small size medical school were all related to be more stressful. Most topics of stress were associated with the changing of learning methods, online learning and online exam. Small medical school provided less support in terms of mental health care system, equipment for online learning, and the changing of grading method. And students who in small medical school were less satisfied compared to medium or large medical school. Stress relief activity was in the highest line in the support student needed. For clinical year student, activity to enhance clinical experience was ranked in the first place. Large school, student in large medical school need more activities to enhance clinical experience, while students in small medical schools need more financial and mental health system support. And I also would like to thank our team who contribute to this study. Any questions?
For excellent talk about the interesting research about stress in medical students. Let's go back to Dr. Shao for her second part. Okay. Dr. Shao, are you here?
Yes, thank you.
Yes, please. Sorry for interruption.
I'm really sorry.
Yeah.
Really sorry for the inconsistent of internet.
Yeah.
So let me resume from where I start.
Yes,
I
please.
think it's here, right?
Yes.
So yeah, so based on what we talked about the online education, there are still some problems exists. So there is a cartoon on internet describing that what doctors in 2030 may be like. When they are presented with a case that they've ever learned during the epidemic, it may be a very difficult case for them because it was learned in the epidemic. So we had a survey of our undergraduate of PUMC and also graduate students. About 200 undergraduates and 400 graduate students took the survey. And when asked about what kind of education modes they will
Oh, it's very common problem from internet. Okay, Dr. Shao lost again about internet connection. So don't worry, let's move.
bring their anxiety because it's different from the previous learning, and also worry about the future tests. But when students can get social support from the school or their intimate members, this anxiety can be decreased. Another large study from come from the Sichuan province. It includes about 1,000 students, and in this study, a similar number of 26% demonstrated clinically significant psychological distress, and some met about 10% met the criterion of acute response. And in individuals who scored high, interestingly, these students have been measured before the epidemic. And the researchers found that in a prospective way, if individuals who have been sky high on both childhood anxiety, adversity, and stress for life event experience, they were at increased risk of both distress and probable acute reaction. So although anxiety can happen in any students, those who had a tendency to show a vulnerable state are more easily to get affected by this. At last, I think the COVID-19 epidemic had led us a rethinking of the role of medical students in the response. We know that in some places, especially in Europe and Australia, there is a call of final year medical students into the real anti-COVID-19 battle. While in China, there's always debate whether these students should be sent to real clinical practice during the epidemic or not. Of course, those are still remained in preclinical practice students. They were not very suitable to be working in site. However, some of our professors and doctors still demand that students should be sent in a proper way to be involved in real clinical practice in such a kind of epidemic, because that is what real life will like after they have graduated. So basically, the responsibilities should be within capabilities and under supervision and institutional legal protection. We should protect and to guarantee the safety of the students. Under that situation, maybe appropriate involvement in clinical practice of the students should be considered in the future. That is all. Thank you very much. And thank you very much for your patience of the two divided section. Thank you.
Shao, for a very, very interesting talk. I learned a lot from you. Thank you. Thank you. Let's move to the last speaker, Dr. Merti Andreastuti. She's from University of Indonesia. Her specialty is in about hematology and oncology. Now she's a manager of education, student affairs for undergraduate and doctor program. Welcome, Dr. Merti, for talking about support system for students during COVID-19 pandemic. Welcome.
Thank you very much for your nice introduction.
Yeah.
Let me screen share first.
Can you share the screen? Can you share the screen?
Yes.
And for the audience, please prepare for your question. After we stop, after we finish, I will let you to have some question. Dr. Merti, can you share the screen?
Sorry.
Are you okay? Oh, we got it. Thank you. Could you please place the full screen mode? Oh, excellent. Thank you.
Sorry.
Yes.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Thank you for this opportunity. It is a great and pleasure for me to take part of this meeting. And then this is, I will share about the student journey in our medical medical student to tackling challenges to continue medical students during the COVID-19 pandemic area. And then this is my outline for presentation about the current situation and then adaptation for academic curriculum, support for students and students' activities during the pandemic. About the current situation, as we know, in March 2020, WHO declared about the COVID-19 as a global pandemic. And then also in Indonesia, we found the first case confirmed COVID-19. And then after that, the case increasing in our country. So we changed the learning method for our medical students to study online from the in March until July. For clinical rotation, we started to blend it online and offline learning method, and we started in mid-July 2020 for clinical student. And it is about the situation in Indonesia compared with the in the world, in global situation. And then it is in Jakarta now the case confirmation COVID-19 is dramatically increased in last the several days. And then also we plan to maybe to adjust the situation according to the last condition in Jakarta, that because our medical the UI, the Faculty of Medicine, is located in Jakarta, and also our teaching hospital, Cipto Mangunkusumo Hospital, also located in Jakarta. We have around 4,000 medical students. It consists of the medical doctor program around 30%, and then resident almost 50%, PhD program 5%, master program 8%, and the fellow subspecialist program is around 7%. So nearly we have almost 5,000 students in Faculty Medicine, Universitas Indonesia. And then for a clinical student, we have around 450 students. And then this is the adaptation for academic curriculum. And then our university also faculty has a response to this pandemic, and then we have several regulation made to minimize transmission and provide safety. And the principle is we are responsive to the dynamics of this pandemic, and the dean also has decree the adjustment in learning system during COVID-19 pandemic, and has task delegation to the head of academic program, and also asked for the head of the module modified all the curriculum that we have to change from offline to the online, or the for clinical student is blended between online and offline. So we also open to input from all faculty members, and we have the close collaboration with the Committee of Education from the teaching hospital to monitoring and evaluation about the condition of medical student, or the update condition of the hospital, because now our teaching hospital is also a referral hospital for the COVID-19 case. And then this is our effort to continue medical education, and the primary goal is the pushing students forward on time and as safely as possible. And generally, medical education is continued with online learning. It is especially for preclinical students. And we did all several activities during this pandemic era, like admission of new students. We we do all the admission with the online interview with video conference, and then for official education also we all changed to the online method, and then the evaluation also we do for with online, and discussion with due to online, and blended with the discussion with the supervisor offline in the hospital. In mid-July, for the clinical student, it cannot be done full online due to the competency that the medical student have to achieve. So they have to come back to the hospital to continue their clinical rotation. And then before they went into the hospital, the clinical student is we have a meeting with the clinical student and also the parents, and we explain about that clinical rotation that the student must do during this pandemic era. And then we ask to the student must fill the statement letter acknowledged by their parents, and then also if the students want to take leave with during this pandemic era, it is okay for us. This is depend on them. And then we also ask all the students proof of the health insurance membership. So this is prepared for with some things students happen and then need for the hospitalization, and then the student must did a quarantine arrival to Jakarta before they start for the clinical rotation for 2 weeks. And we plan to prepare for the PPA for the students. This is the example for joint degree between the dean and the director of our teaching hospital. This is especially for our residents and fellow content of the how they continue their study during this pandemic, and then the change of the curriculum, and then how we protect, the hospital protect and the faculty protect for them, for our resident and also for our fellows. This is academic activities. We do the Hippocratic oath for online for our student who graduated in April 2020, and now they all going to internship and start work in a rural area to help the health workers in this era. And then this is activities during pandemic for preclinic students, and then this is the quiz, OSCE, and also tutorial, discussion, all the things for preclinical students we give online. And it is academic activities for clinical student. In clinic, we only allow only 3 students and 1 supervisor, and the supervisor must work until the study is finished, and then not every student must under supervise. And this is also
Are you okay? Could you please open your microphone? Yes, please.
Yes.
Okay. Could you please share your screen again?
Share screen.
Thank you.
Yes.
Thank you.
Okay.
Yes, good.
And this
good.
is our staff have made the module is for COVID-19 module. This is made by our staff. So this is the new module at the compulsory for our student to take this module before they start to continue their rotation in clinic. So this is everything about the COVID-19, the PPA, and then how to infect, like etc. So the students must join this module, and this is before they go to the clinical rotation. And this is not only for medical student, but it is the module compulsory for resident and also for the other student in our faculty. This is the support for student. This is financial distribution of PPA and also health and well-being support. For financial support, because before the clinical student come back to Jakarta, our student is spread in all over Indonesia. So some of them has financial constraint for transportation or for accommodation, living costs, because the COVID pandemic era is also impact for the parents financial of their parent. So we identify and connect student in need for financial aid to voluntary benefactors. Mainly we ask for from the staff, alumni, and we have also association of students, parents. So we can support the student with the financial constraint to continue their clinical rotation in this era. And this is support for the resident. They all covered by the insurance, the government insurance, and then also from the government, they give incentive for all the residents, and then we collaborate with the NGO to do a free swab test for resident. And now for medical student, we also have the donation also for free swab test collaboration with the laboratorium or microbiology from the medical faculty Universitas Indonesia. So this is the support for our medical student to handle this COVID-19. It is about PPA. We have some donation for our medical student for from the alumni, and then for the Ministry of Education, for NGOs, and all that donation is comes to a faculty, and then we supply all that to the student through the program head of the program study, and then they will spread this donation to the students. And we have the questionnaire about the students' condition. Maybe this is for the preclinical student. Around 300 students take this from this questionnaire. And I think it's almost the same with the previous speaker. The academic is the 50%. It's the support that the students need. And then 35% is a problem with the health problem. Also the mental problem, and then also financial problem. So I think this is the same problems in medical our students. So for the clinical student, we make the algorithm for 6 students, so they can follow this algorithm. So we have the responsible staff who is responsible for the health condition of all the students. So they have to report about their condition, and then we will get the solution about this about their condition. This is also with the student who confirmed the COVID-19, and we're doing rapid test, and then if the reactive, we do the swab. This is a free swab in the microbiology laboratory, and then also if the swab positive, we have the staff who is responsible for the children who get sick for this COVID-19. And then if they need to hospitalize, we will collaborate with the Cipto Mangunkusumo Hospital to take care of the students. About the activities, yes, during this pandemic, students registered to be a volunteer in several places. Is volunteer in the led by Ministry of Education, and we also had the platform for COVID-19 response by the medical students, and then we have the student movement set as nutrition, giving nutrition for the all health workers, and also PPA for the health workers. This is co-founder from our medical students, and then agency and also volunteering for Indonesian medical education. This is one of the activities for one of our student. He met the COVID-19 screening and education platform, and under supervised by our staff. And then this is one of the candidates to win of in our country to win the community engagement. Yeah, hopefully he will get the prize for these activities. And this is about the nutrition for frontline workers. This is co-founded by one of our medical students. They give the nutrition for all the frontline workers who work in hospital. So I think not only in Jakarta, but they also send that nutrition for health workers in outside Jakarta. So they do is during this pandemic era. And it is cohort. This is special for the PPA donation for health worker also, and all the hospital, and already they give to help the health workers has the good PPA for this pandemic era. And this is only quality time. This is quality time in quarantine. It is a webinar series to keep people who stay at home mentally healthy despite experiencing financial, social, and mental burden during the pandemic. This is led by our student also, and this is reached around 500 until 1,000 people per session. The scientific review, they have also the scientific review about COVID-19, and one of the our student is published in international journal about the obesity as a predictor. This is a systematic review. She already published. This is one of our medical student has achievement to publication about the COVID-19. and it is against of hoax with COVID-19. This is also activities for our students, and the students also made the face shield, and then they made by themselves, and then sent to the other hospital. So this is funded by Corona Response Fund raised by medical students. So they make the face shields and give to the doctor, nurse, and other health workers. This is volunteering. This led by the Ministry of Education. Around 100 our medical students join this volunteering, and then this is all do in online method. This is also online campaign that we did. Like this is they give food for the online driver. This is a lot of online driver in our country impact about this pandemic era. So they give food for them, and then this is also they make the how to do salat for a Muslim in with the PPA. So yeah, they I think their activities is still full within this pandemic. And the conclusion is the COVID-19 pandemic is catastrophic event to everyone, and the faculty commits to helping the students and support students who need financial assistance, PPA, and health support or psychologist support. And during this challenging, the student very motivated to contribute to the war against COVID-19, making innovation, volunteering, utilizing the social media. And I think the important thing is close monitoring students through their mentor. So we still know about their condition through their mentor. So we will make several discussion with their mentor to help the student get the solution of their problem. I think that's all. Thank you very much. Come back to the moderator.
Okay. Thank you so much for your kind, very good, excellent presentation, Dr. Mati. Let's have if there are any question from the audience about student journey. Okay. You can open your microphone and can ask the speaker. Okay. I would like to ask all the speaker about, do you have any plan for the second wave of COVID-19 in your country to support your student? Yeah. I would like to ask Dr. Shao, Dr. Owar, Dr. Tidarat, and Dr. Murthy. Any plan for the second wave or first wave? Yeah.
I think I just want to comment the moderator about your questions.
Yeah.
Hello.
Yes, please.
Can you hear me? Yeah. I think no one is expecting for the coming of the second or the third.
Yeah.
Yeah. I think from all the presentation, it is very clear that this situation make us or have us to prepare, make us have to prepare for the different situation, different normals. And now I think from the the how we tackle with life, how we tackle with the educations, it is very clear that we learn a lot. Not only for my perspective, it is improving our practice in teaching and learning, and how to how to plan the strategy so we can achieve the target, but also we can keep everybody that's involved in these activities is safe. So I think this is a more challenge than what we need to avoid. So we learned a lot, and I think this is the new beginning, and still more and more changing is coming ahead. Thank
Okay.
you.
Thank you so much. Thank you so much, our speaker and our participant for this session. I would like to turn back to Dr. Varut for the end of the session. Thank you.
Okay. I think, and now we are coming to an end of these sessions. On behalf of Faculty of Medicine, Siriraj Hospital, Mahidol University, we would like to extend our special thanks to all distinguished guest speakers for your valuable time to support and join us on this online meeting. Until we meet again in Cambodia, thank you very much.
Thank you.
Thank you.